What's going on, everybody? It's Childish back at it again, coming at you with another health and wellness video. In today's video, I got something special for you all. We're going to be talking to Dr. Arnoldo Moran with Kinetic Chiropractic to talk about some of the things that I'm going to be looking to do to improve myself in 2021. Dr. Moran, how are you doing today, sir?
Doing good. Glad to be here. Doing well. So
Yeah. So it's a pleasure to have you here. This is kind of different because we're fortunate enough to be able to connect literally live in my house right now. So this is kind of crazy, right? Before we get into the stuff here, I do want to address all my new fellows out there. If you're new to the channel, welcome to the channel. My name is Chris, but I go by the name of Childish, and I've been a content creator for the Summit Resort community for the past 7 years. And in that process, I had a lot of struggles that I dealt with along the way, which kind of led to about a 60-pound gain from 2017 to 2018. So moving into 2019, I ended up buckling down and losing the 60 pounds that I gained, basically getting into the best shape of my life. And a lot of people they thought it was a really positive thing, and they wanted to see more of it. So in 2021, I made the commitment to go ahead and change myself for the better, not only doing what I got to do to look good, but feel good. And that's in line where we're kind of here right now, because a lot of the things that I have going on in my internally, when it comes to joint mobility, flexibility, a lot of those things has been rectified in the past through Chiropractic Care. And so that's why we have Dr. Moran today. We're going to be talking a little bit about this and basically talking about what we're going to be doing in 2021 in order to get myself better. So I guess the first thing I want to do is essentially give you the floor here. Tell us a little bit about yourself. I mean, this is a kind of interesting story.
I'm Dr. Moran. Have a clinic here called Kinetic Chiropractic, and I've been here for about 5 years. Before that, we had a clinic in Colorado for about 5 years, and then I worked for somebody for about a year, and then had college before that. So it's been going good. The clinic here has been growing. We've been each year keeps getting better and better, and we keep seeing more and more people, keep helping more and more people, and we see a lot of pretty unique cases, and it's going pretty well overall. So I'm glad to have Chris over here, and we're gonna get him fixed up, help him reach his goals and stuff. So
yeah, it'll be great. And if I may ask, how long have you been as a chiropractor? How long have you been at the
2008, so okay. 13 years. So
okay, so 13 years, quite a bit of time. A bit of time, definitely.
Yeah, so it's 13 years this month, actually.
Yeah. And so funny enough, if I can get into the story real quick here, the reason why I was able to find Dr. Moran was, it was super funny. I was sitting here going through my mail. As you guys know, we all get junk mail, right? Stuff that we keep on throwing aside. But literally the first time in maybe years, I took a look at the junk mail and see this Kinetic Chiropractic $39 exam. If you want to go in, and I was like, that's pretty much the same, price as the chiropractor that I've been using off and on when I have some issues here. So I'm like, you know what? I'm just going to go ahead and give it a go. He's really close to me, so I'll go and check it out. And then funny enough, we walk in there and I see him, and he doesn't recognize who I am, but it literally, we're high school. We're from the same high school here, 22 years. I don't even remember how many years now. You graduated in 98.
You were 99.
I was 99. So funny enough,
years, 20.
Yeah, 20 some years there. It's crazy to think that it randomly just decided to take a look at this and go find it. I found somebody that I used to know literally 20 years ago. So
and it's kind of funny. I didn't recognize him because Chris looks. I mean, he's like this buff, dude right now. He looks like this, buff, athlete, alpha dude. Right. But like back in high school, not there. No. I was kind of a shy, quiet kid, but the transformation in Chris is pretty incredible. And the way he looks now is completely different. So it's I don't think if anybody from high school, if you talk to everybody, I don't think anybody would
I don't know if they would recognize me, but maybe one of these days they'll recognize me. It's all good. But let's go ahead and get into it. So for a lot of the people out there in my community, right, that this is this platform that I have going on here. It's for video gamers, people that play the main game that I showcase, which is Summoners or Sky Arena. But a lot of people out there, may not know a whole lot about all the things that I'm doing. So I was wondering if you can just kind of give us a brief overview on chiropractic care. What is it about? What is it in a nutshell? How is it beneficial to people?
All right, so I actually came prepared.
Look at this guy
today. So I brought the spine here. Felt a little funny bringing it over, but
just walking through the neighborhood.
Yeah. So everybody's walking. Saw people driving by. I was like, what are they thinking of me bringing the spine in? But anyway, so the main thing that as a chiropractor that I do is we deal with the nerves. We look for any kind of misalignments of the spine that puts pressure on the nerves. We call that a subluxation. So normally when everything's moving properly, you're going to feel great. And let's say you have an injury, one of these move out of position. I'm going to exaggerate here. Moves out of position. It's going to put pressure on that nerve. It's going to affect whatever area it goes to. So let's say You know, if somebody gets an issue in the neck, they're going to get neck pain, headaches, other issues. Sometimes it sends pain going down the arm. The mid-back, you get mid-back pain. This also goes to like your heart, lung, stomach. Sometimes people get heartburn or indigestion here. And the low back, you get low back pain, sciatica. But this also controls like your bowel, bladder, male, female organs. Some might get like digestive issues, male, female issues. And with Chris in general, we're looking at the SI joint. So the SI joints between here, your pelvis and your tailbone here, that joint right there. We're looking to get some movement in there. When we did the exam, we found the misalignment there. So when we do the exam, I generally feel for the movement of the spine. So when I'm doing the exam, just put a little bit of light pressure on there. And I can feel areas of misalignment. And so we have like this misalignment here. And when we do x-rays, it's also another way of showing up on there. Like when a lot of people have something like this, they take something for the pain, but once it wears off, they're back to feeling the same again. So what we do is we look for these areas of misalignment, and we do the exam, do the x-rays, we find them, get it back to normal, gets rid of the pain, but also lets you know that we got it fixed, and it's not gonna, be a problem anymore. So that's basically, chiropractic in a nutshell. We look for joints that aren't moving properly, and I get them to move properly there.
Right. So you essentially just manipulate the spine, manipulate certain joints in order to release a lot of pressure and kind of get the body feeling pretty good.
Yeah. So my job is pretty easy. So it's
it must be nice.
It's pretty easy. I find the joints that aren't moving, I put movement in them, and then the body starts working normally. The body, it's incredible. All we got to do is just get it moving, and then it does all the work there. So
right. And one of the things that I was talking to you on the side is the fact that this whole aspect of chiropractic help, especially nowadays with regards to the pandemic, this is a nice alternative option for people to get care if they have those type of acute pain areas that they want to address here. Especially if they can't get into a doctor, especially with all the things that are going on.
And one thing is that they allowed us they considered us to be essential because they didn't want people with back pain or headaches going to the ER. Filling up the ER with when they're trying to deal with the corona stuff, so they don't want to make sure that they don't get anything like that. They want to make sure that they limit the number of those cases going in so they can deal on other stuff that might be more pressing at the time. And also, we're the way we deal with it is more, I can, at least in my opinion, more beneficial, because if a lot of people, if you take the meds for it, it's like something you have to take every day, whereas like we just go in there, you fix it, and it's something you don't have to take the meds anymore either.
Yep, definitely. Now, one thing the reason why I thought this would be super cool to bring this on a channel is because a lot of you guys right now are probably shaking your head like, oh yeah, chiropractic care, why do I need this? What's the deal? But the reality of it is that a lot of us here are video gamers. A lot of us sit here in front of our PCs, in front of our phones, sitting here in slouched couches, putting a lot of random pains, and just we're just in these funky little positions that all of a sudden develop this kind of acute back pain or neck pain or whatnot here, some stiffness, whether it's from work or from video games. But a lot of you guys are video gamers, you can relate to, and Lord knows if you're like me, I got a lot of issues that I got to deal with when it comes to that topic. So I'm glad that we got a chance to connect here and talk about it, because I feel like there's definitely a handful of people later that can use some assistance in this matter. Now, let's go ahead and if you don't mind, let's get into like the chiropractic care, because you're always gonna have that one person that's like skeptical about it. Like maybe talk a little bit about the benefits versus the risk. Like, there's got to be some kind of risk when it comes to this.
Well, there's some risk to it, but it's pretty minimal. When you look at like the insurance, like my malpractice coverage, like I pay more for my car insurance than I do for my malpractice insurance. So it's like insurance companies, they don't play favorites. They look at the data and they base their rates on whatever their risk assessment is. So it's like chiropractic, it's really low compared to like there's other more high risk physicians, maybe like like surgeons, or people do anesthesiologists, that kind of stuff, where it's a lot more risk. Their malpractice is a lot higher because it's statistically more risky with what they do compared to what we do. So there's very minimal risk. But as far as like the benefits, there's a lot of benefits. Like what you were saying, actually our office has grown a lot since the pandemic, because we're getting a lot of people there's a lot of people around that live around here. And before they used to have to drive downtown and come back, but now they're all working from home. They're working on their couches. They're working on their their coffee tables and their beds. So they're just they might not have ergonomic setup. So I'm seeing a lot of issues from that. They don't have very ergonomic setup. So as far as like the benefits, so like kind of what I was talking about earlier, we look for these areas of misalignments in the spine, and we get them. So if let's say if the issue's here, I'm going to put motion in that joint, and and then over time that joint's going to move properly, and that's going to fix the issue. So it gets rid of the pain, but also make sure that it's not a problem going forward there. So there's a couple benefits. Like a couple studies have shown that just even getting adjusted, it's going to lower your the pain, but it's also going to it's been shown to decrease like the amount of medications you have to take, sure. Miss fewer days from work, and overall like your health is improved just because your body's working better.
Yeah, it's a lot more functional.
Yeah. It's kind of like keeping your car in good shape as opposed to having an issue and fixing it when you have an issue.
And that's what I was going to say too. The prior chiropractors that I work with here, a lot of the times I didn't really, I would either go in there because I pulled something, pulled my SI joint, or I would, just go in there, once a month or twice a month, just to get kind of like I said, like a little primer, little maintenance, little as needed kind of a fix there. So it's nice to be able to get that done and just make sure that everything's working properly. Now, funny enough, the issue that I have is SI joint, which again is kind of in that lower back area. I feel like when it comes to all the things that you do, lower back pain or just back pain in general is probably like the number one thing. So maybe you could tell us a little about what a typical treatment is at your facility that you do when somebody has a lower back pain. What kind of treatment do you do? So,
we start out with so everybody comes in, we do a consult, so just to see if they're a case that we work with. I've been doing it for a long time here now, so it's like pretty much everything that's been seen, I've seen, and so I get a good idea of, okay, this is a case we can help, this is a case we can help. If we can't help them, I tell them where they should go, and then so I do the exam, and then depending on what we find during the exam, we'll do X-rays, and the X-rays will tell you 100%. The X-rays don't lie. It's right there, and if somebody has an issue, it'll show up on X-ray, and a lot of all the adjustments I do is really based on what I find on X-ray. So if we, here's the spine. So some people will have, maybe this, the hip be out of position like this. So we got to adjust it to get it back to normal. Or they'll have some rotation in there, and we got to get that back there, or any kind of alignment issue. So it's basically that's how we do it. So we do the exam, we do the X-rays, and then I do a treatment plan. It's kind of like, when you go to PT. You have to go in a certain number of visits, same kind of thing. It depends on how severe the case is. Usually, by the time somebody sees me, they've had the problem for years. It's like if they've had it for a little bit, there's not much. Or somebody wakes up with a sore neck, it doesn't take too much. But if something they've had for years, look at the X-ray, there's arthritis, degeneration, bone spurs, all this stuff, then that's something that's going to take a little bit longer. So I just develop a treatment plan for each person, and then we work on it. Typically, my treatment plans, we do the chiropractic adjustment, which we recorded. So Chris will be showing you that video, yep. and we do some therapies. We do traction. We did the cupping. We have other therapies like laser therapy, stim, and a few other things. So we do a few different therapies. So a couple different strategies for different people, and it depends on what they have, and we're able to make it or their care plan personalized for them, whatever their problem is.
When these people come to you, ask you questions, as far as doing adjustments and trying to get them a little bit of pain relief, obviously there's a lot of things you could do at your facility over there at Kinetic Chiropractic. But every once in a while, I'm sure you run into family, friend, loved one that maybe can't get a chance to reach out, or maybe they're not don't even live in Nebraska, they live somewhere else. There, what are some of the alternative recommendations that you can give somebody for pain relief? So if there's somebody watching right now, sitting on the couch right now, dealing with some pain outside of taking ibuprofen, right? What are some of the things that people could do? Just
the basic stuff that you would do to keep your health in general. So you start with the basics. You try to get plenty of sleep. Eat right, exercise. Especially back pain, you want to do some stretching, get some mobility in there. Things like yoga or basic stretching. You can watch YouTube videos or get some instruction online. Just any kind of basic stretching. And basic exercises, if you build a core, if you have a decent core and you have good strength in there, generally, I find that people that work out and do that, they can have a lot of issues and their body won't really have that much pain. But if they stop working out, then everything just piles on and then it just comes on. So those are be the easy things. Try to, whatever if you're carrying a lot of extra weight, try to reach that goal, because all that weight's adding stress to your back. The stretching, eat right, exercise, And then, if you need something else more, I mean, you could do chiropractic care, physical therapy, massage. There's acupuncture. There's a ton of different, practitioners and therapies you can get to try to help out. But I mean, just you can start out doing all the stuff by yourself and just try to get your health as best you can would be the first thing to do. And then you can reach out to a professional if you need more help then.
Gotcha. Sounds good. And I don't know if that's something you guys offer on your website or whatnot, but do you have, like, when somebody comes to you and they say, hey, maybe there's some kind of stretches that I can do to, kind of work things out after adjustment. Is there any kind of like, kind of diagram or information that you provide as far as being able to help
I give them like a list of each. I have a couple sheets that have different exercises on it, and then I just circle the one I think would be good for them. There's also some other, some specific home care items we have for certain cases, some for neck or some of them for back, foam rolling is good if you're into foam rolling is really good for like muscles of the back, sometimes between those some of the glutes, helps out the back, also like sometimes the shoulder, you get the lats, you get some really tight muscles in there. It's really good for getting those. So that's something you can do at home as well. But
cool.
So yeah, it's kind of tough because I give those people, but maybe like 1 out of like 50 will do the exercises. But you just give it to them, and you just. I always tell people, it's like, I'll know if you're not doing it just to try to get them to do it. But like most people, life happens and that kind of stuff.
And quite honestly, I'm so glad that you said that right now, because that's the reality of what I'm trying to do, what other people are trying to do when it comes to health and wellness. We all kind of have this like idea of what we want to do, what we want to accomplish, but a lot of us can't, keep it going, can't, be dedicated, be disciplined to see it through and be able to succeed. And that's the funny thing about what I'm doing right now for you guys on camera. I literally just got done putting a before video showcasing it. So, if I don't show progress here in the next couple of months, unless I have some kind of personal spot, you guys already know that I'm not doing what needs to be done. So I'm actually really, really excited to see, what's going to happen down the road. I mean, not just from doing chiropractic work, but just doing, I'm going to be doing some yoga. I'm going to be doing just some, random core exercises that I don't really do. I'm going to go back to training my calves. I haven't trained calves in a long time. So like I said, I'm just all the weird things that I always neglected. I always pushed it aside. I'm going to try to keep it consistent. I want the community to keep me accountable for what we're doing. So yeah.
You don't want to be the guy with big guns and tiny
legs, man. Right? That's it. You don't want to be that guy. You definitely don't want to be that guy. Well, thank you so much for that information. And once again, guys, if you didn't get a chance to catch the beginning of the video and all the information we provided, this is Dr. Arnoldo Moran here with the Kinetic Chiropractic family here in Omaha, Nebraska. I'm going to leave all this information down below in the description. So if you are local and you want to go ahead and check them out, we would greatly appreciate it. Okay, Dr. Moran, thank you so much for your time.
Thank you.
It's a pleasure to have you here. And like I said, guys, we're going to be keeping in line, staying tuned in about a month, 2 months, 3 months. We'll show a little bit of progress. We'll see if we can make, we see the adjustments that we've been making on a weekly basis are paying off. And hopefully we got something super cool to show you guys in the next coming months. Okay, so that's going to be it, guys. Thank you all so much for tuning in. It's your boy Childish and Dr. Arnoldo Moran with ChildishPlays checking out. Take care, and we will see you guys in the next one. We're out.